I'm Ken Culver. I'm a physician and the Director of Research and Clinical Affairs for ALK Positive. ALK Positive is a patient-led, patient-founded, patient-run, patient-funded organization that's really purpose is to drive research and increase the opportunities for a cure sooner rather than later for our patient population. It's always fun to come to ASCO because it is where the world gathers to talk about the latest advances. This year, we haven't had any major breakthroughs for ALK therapies like last year when the CROWN data was presented and we saw this amazing long-term benefit of the drug in the first-line space. But what I'm missing this year is there are a lot of trials, especially in the immunotherapy space, that aren't allowing ALK patients to be a part of it. This seems to be based on the fact that the initial trials with Pembro and Nivo were negative in ALK patients, despite the fact that many of them are PD-L1 positive. But we have to remember that just because a patient doesn't respond to one checkpoint doesn't mean any of the other 70 checkpoints might not be relevant. And so we're really hoping that there'll be new opportunities for ALK patients, especially in the immunotherapy space. But I think most of us believe that without an effective immunotherapy as a part of the treatment regimen, we're not going to get to the cure. One of the best parts of being here at ASCO is I was here with 6 of my colleagues, one young woman who's an employee like me of ALK Positive, and then 5 patients. And we had the opportunity to go as a group around and meet with different biotech companies and pharma companies and some of our collaborators to talk about how can we move things, not just move forward, but with urgency, we move things forward. And I think I witness it over and over again that it's a mutual benefit. The patients see the energy, the bright minds that are really trying to solve cancer therapy and to get us to a cure. But also a lot of the people working in these corporations don't normally get to have much interaction with patients. And so I think it's inspirational to them. And I'm hoping that there's sort of a synergy that comes out of that. It's not just good feelings, it leads to tangible improvements and new opportunities for our patients. And I do believe that is happening, but I want to make sure we don't lose our momentum as we leave ASCO and go back home. Late in 2024, we created our scientific advisory board, and we have 12 very august members of that group. And here at ASCO, we had our second formal scientific advisory board, where this time we focused on what are the key things that physicians should be doing when a patient progresses. What is the minimum biomarker evaluation needs to be done? NGS, FISH for MET amplification, MET for IHC, HER2 IHC, things that are approved in the space that can be used for patients when we can identify their bypass mechanisms and give them hopefully an effective therapy to kill off that clone and patients can continue on TKIs. So they've been giving us a lot of really great advice. We also have our own internal research program. We're really trying to identify new drug targets, looking at bulk RNA-seq, and they've been providing us some really great guidance and collaboration. And finally, working with our SAB, our goal is to start a number of investigator-initiated clinical trials this year that are funded by our patients. We're partnering with the companies and with universities because if we can get the pilot data for those particular drug combinations, now hopefully companies will take them on and develop them for the larger population. We're really focused now on trying to get as many of these trials started. So we're hoping before the end of the year, there'll be 2 vaccine trials started for ALK patients, 1 for sure, and hopefully 2. And there are a couple of other trials, combination trials for patients who are progressing on a TKI that we're hoping to start. And our goal as an organization is to make help those trials enroll very quickly. Because we realize for the companies, time is money. And we realize for patients, time is life. And so we have a common goal here, and that's keep pushing with this sense of urgency to move the bureaucracy. And of course, what's going on with the Trump administration is only making it way harder and complicating it and making everything more expensive, which is a real tragedy But we're trying not to focus on that, and we're trying to focus on pushing things forward.